years in independent practice. He is active in organized medicine, having served as president and chairman of the Montgomery County Medical Society. He also served as chair of the Montgomery County Medical Legal Committee and the Montgomery County Task Force on Mediation. He currently serves on the Board of Trustees for both the Pennsylvania Medical Society and their Political Action Committee. He's an active member of multiple grassroots advocacy groups. And here's Mark.
I got one question. How do I follow that? Wow, that was impressive. I'll do my best. First question here, forgive me, I'm losing my voice.
Good.
Why am I qualified to speak today? I am a physician, I'm a healthcare advocate, I'm the author of a book about how our healthcare system is failing us, and perhaps most importantly, I'm the parent of a child on the spectrum. And some people would argue I have some autistic traits myself. So this is deeply personal for me. The second question, why am I here? I feel compelled to call out RFK Jr. and help people understand the damage that he's doing to our society and to our healthcare. In fact, this past June, I wrote an op-ed about Mr. Kennedy's comments on autism and vaccines. In that article, I emphasized his disdain for the truth. The last lines of that op-ed read, "Rest assured that Mr. Kennedy will cause great harm to the health of our society. In fact, he has already done so." I was not alone in my opinions. Physicians across the country were and are quite concerned about what Mr. Kennedy has done and will continue to do. But I gotta admit, I got it wrong. I underestimated the amount of damage that RFK Jr. could do. The evidence is overwhelming and includes the following. The firing of Susan Minares as head of the CDC because she, quote, refused to rubber stamp unscientific, reckless directives and fired dedicated health experts. She instead chose protecting the public over serving a political agenda. Imagine that, somebody with a conscience. The resignation of Dimitri Daskalakis as the director of the National Center for Immunization and Respiratory Diseases. In his resignation letter, he stated that he was unable to serve in an environment that treats the CDC as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than to improve the public's health. Other CDC resignations followed, including one official on Mr. Kennedy's team who resigned when Mr. Kennedy asked him to, quote, change studies that have been settled in the past, referring to Mr. Kennedy's anti-vaccine views. And then there was the hiring of David Geyer as the lead investigator to again study whether vaccines cause autism. Mr. Kennedy promised us an answer by the end of September. And I think it's just more than a coincidence that on September 27th, it came out that Tylenol causes autism. Boy, that was rather convenient. Mr. Geyer is a known vaccine skeptic and a discredited researcher who was disciplined by Maryland regulators more than a decade ago for practicing medicine without a license. This was the man RFK Jr. picked to study vaccines. He also fired 17 independent experts from the advisory committee on immunization practices. Instead, he replaced them with his own hand-picked vaccine skeptics. There was also a recommendation to eliminate the combined MMVR vaccine. This came from Mr. Kennedy's advisory panel. They were unfamiliar with the study designs and were confused regarding their role in approving vaccines for the Vaccines for Children program. Didn't stop them from making recommendations, though. He has also placed restrictions on the approval of COVID vaccines. What does that mean? It makes it more difficult for individuals who want to get the vaccine to get it. They may now need to take the added step of making a doctor's appointment to get approval, and who knows what insurance will or will not cover. He has made repeated public statements conflicting with well-established medical evidence, including false claims linking vaccines to autism. He said that the COVID shot was the deadliest vaccine ever made. And he said that the polio vaccine killed, I gotta get this right, many, 5 manys, many more people than polio ever did.
Oh my God.
He was likely referring to the Qatar incident, where a vaccine batch back in 1955 became contaminated. It was quickly rectified, but somehow that slipped his mind. And he chooses to ignore the fact that the polio vaccine has overwhelmingly and repeatedly been determined to be safe and effective. And get this, he actually made the statement that, quote, "There's no vaccine that is safe and effective."
Boo.
My response, really? Based on what? I've taught my medical students never to accept a statement without knowing what it was based on. And based on what has become, don't want to lose that, it's become a catchphrase for me. Based on what? What is he basing this information on? I guess the elimination of smallpox, polio, measles, etc. as major public health problems because of vaccines is completely irrelevant and should simply be ignored. It's hard to turn pages when your hands are frozen. But worse than all that is his denial of ever having said that, despite video evidence to the contrary. This is a prime example demonstrating Mr. Kennedy's lack of credibility, lack of accountability, and may I say, lack of integrity. I do not hear enough being said about that.
Yep.
At his Senate confirmation hearing, he said, "I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those vaccines." Obviously, his words then and his subsequent actions regarding vaccines are not on speaking terms with each other. It appears that Mr. Kennedy will say and do whatever serves his underlying agenda, regardless of the truth or how it hurts others. How else can we explain his lies at his confirmation hearing?
Nope.
As I said, the issue is especially important to me as a physician and a parent of a child on the spectrum. I am therefore passionately invested in what Mr. Kennedy says and does. To put it simply, misinformation directly erodes patient trust and adversely affects public health. Patient care should always be our #1 priority. And it offends me when a public official sacrifices evidence and facts in exchange for an underlying agenda. In August, Senator Bernie Sanders, in a New York Times op-ed, called for Kennedy to resign, as have more than 1,000 current and former HHS employees. That's wishful thinking on Senator Sanders' part. It is my opinion that Mr. Kennedy has clearly demonstrated a lack of concern for the American public. So I would be absolutely shocked if he chose to resign.
Yeah.
You know, it makes me think, with all this talk about vaccines, what we really need is a vaccine to protect us against Mr. Kennedy.
Ooh, amen.
It is therefore imperative that Congress act accordingly. I call on all legislators, especially Republicans, and I am a registered Republican myself. I'm calling out my own party, and especially the Senate physicians, and I'm a physician myself, to uphold scientific integrity and take the necessary steps to remove Mr. Kennedy from his current position. Literally, the health of our nation depends upon it.
Amen.
Thank you.
Amen. Woo!